First, I would like to thanks for Matthew and Colleen for organizing this meeting and allowing me to share with you, in presence and also online, some of the results we had in a research we made in Brazil during the pandemic regarding the Brazilian response to the pandemic, the legal response, but not only, as I'm going to show you. And it's really great to put together 3 health law research centers, 2 from Canada and 1 from Brazil, and trying to understand what was the pandemic, how did it change health law in all over the world and especially inside each country, and what kind of lessons can we learn not to repeat the same errors. So I'm talking about the COVID-19 in Brazil and what I'm calling the federal government strategy to disseminate the new coronavirus by contagion. So some backgrounds. After 88, with the democratization of the country, the Brazilian health system has been profoundly changed. Health is now considered as a constitutional human right in Brazil, and it must be protected by the Brazilian state in several manners. Universal and equal access for health public services is guaranteed, free for everybody, regardless of socio-economic condition of the user. Even for foreigners, the Brazilian national health system is open to access. No more need for any kind of contributions to have access to public health services, including pharmaceuticals. We have a very big pharma care in Brazil, struggling against the new prices of biodrugs and biotherapies and so on. But it's very important. We acknowledge that at least 180 million Brazilians depends exclusively of the public health system. They do not have access to any private service because they can't afford it. So this is a system treating of more than 180 million people, and we have to take good care of it. See? Maybe it is easier. The Brazilian health system is spread all over the country, in all regions and cities. So this was a big reform we've made. The map is not so good, but the idea of the public health system is to have primary health care facilities in all cities. We have 5,570 cities. In each one of them, we have a primary care facility and what we call a family primary care strategy. So we have a team with doctors, nurses, dentists, and nurses auxiliaries to go to the houses and treat people. So this is in all cities. And also we have, I think I jumped one. Can we go back? Back again? Yeah. One more? Yeah, this. So in our constitution, we put that Article 196, health is a right of all and Brazilian state duty, guaranteed by social and economic policies aiming at reducing the risk of diseases and other health problems, and at assuring an universal and equal access to health actions and services. This is the constitutional article that we use to judicialize health in Brazil, and that we are using to now try to go against the former president and the authorities who had led a pretty bad policy regarding the pandemic in our country. The Brazilian unified health system so is financed by public budget, and the Constitution will say that the public health services integrate a regionalized and hierarchical network and constitute a national unified system. So we do have a real enormous public health system. Before pandemics, there were big efforts from the private sector to privatize the public system in Brazil. And the pandemic was good for one reason, at least, because most Brazilians finally discovered the importance of a public health system. So now they are supporting it. And even Bolsonaro, with his ultra-liberal government, he couldn't touch in the public health system, especially because there was a pandemic. But he had a plan to do so. And now at least it's guaranteed that we won't change this for the moment. But we have a big private pressure to privatize the public health system in Brazil. The next one. One more. One more. This one I showed. Yeah, thanks. So given Brazil's strong universal healthcare system, at the beginning of the pandemic, I was in Paris. It was March 2020, and a colleague from University of São Paulo called me, and we were pretty sure that Brazil would do great in the pandemic. So we would have the less deaths and cases possible because we had that structure. We had a strong primary health care and a strong public health policy in place. However, Brazil's deaths and case fatality rates ended up as some of the worst in the world. I'll show you in a moment. And we decided at the beginning of the pandemic to collect all Brazilian normative responses to COVID. Everything that the federal government published and everything that Brazilian 27 states published regarding COVID, we collected and analyzed to see how we were juridically, legally answering to the pandemic. We collected more than 30,000 legal acts, and federal government, it was around 5,000. And from this evidence base, I'll try to outline the steps taken and not taken by then President Bolsonaro's administration to undermine the Brazilian response to the COVID-19 pandemic. So let you show you some data. Brazil has the third worst case fatality ratio in the world. Mexico it's incredible. I would like to understand better what happened. We can
what they did.
After.
What they did.
And Peru also, but these are very weird rates. And Brazil is the third one. And we would never imagine that because we had the national health system and historical of good answers in public health demands in Brazil. Also, the next one, if we see the deaths per 1,000, we will see Peru in the first, but Brazil is the fourth, after US and Chile, with 327 deaths per 100,000 people, which is very, very high. If you see Canada, it's almost 3 times lower the rate. The next one. So if you see here, the confirmed cases, deaths, case fatality, and deaths per 100,000. So we will see Peru in the first place in cases and mortality by country, followed by Eastern Europe countries, countries which had presidents who denied the pandemic and tried to pretend that nothing was happening. And we can see the results here. The next one. Brazil will appear in right after this US again. US is not a good example regarding pandemics, especially during Trump's administration. But Brazil is here. Today we have more than 36 million cases and more than 695,000 deaths. It's a lot of people. The last data I saw in Brazil, we have 50,000 children who lost their parents in the pandemic. So they will be orphans for the rest of their lives because of the tragedy and the crisis. And it could be different. Just to, so we have an average rate of 1.9, which is not so good. And the next one, please. Just to compare Canada, you have 1.1 of rate and 130 per 100,000. Much better rates than we had. And why is that so? We, with our analysis and research, discovered that the federal government, since the beginning of pandemic in Brazil, started what we are calling as herd immunity strategy. So under the leadership of former President Jair Bolsonaro, the federal government in Brazil has failed to implement a systematic plan to prevent the spread of COVID-19. Instead, under the pretext of shortening the public health crisis and protecting the economy, the Brazilian government has pursued a herd immunity strategy to be achieved by disseminating the coronavirus by contagion. And this was the bad idea, because it was COVID-19 was very aggressive and killed a lot of people, especially elder people. But he had this idea that we should have this herd immunity strategy by contagion. And he did everything he could to do so. So the next one, please. The study we led gathered and analyzed laws, judicial decisions, speeches, and public statements made by federal officials also by governors and state officials, but I'm going to concentrate my speech on the national level. We gathered more than 30,000 legislative acts from the federal government and the 27 states of Brazil. Almost 5,000 of them are from the federal government, most of them with wrong ideas regarding the pandemic, as we will see. And these records suggest that the government pursued a three-pronged approach to achieving herd immunity through widespread contagion of the public. It's important to say that this research, we published it before we published in scientific journals. When we saw that this was the federal government strategy, we decided to publish it in newspapers, magazines, in social media, etc., because it was killing a lot of people. And it was a nice option because when it became public in Brazil, Brazilian Senate saw the results we had, and everybody was kind of feeling it, but we didn't have the scientific basis to say he's really doing it. So we put this in the paper, and we saw with laws, acts, and species, and he was doing it. He was pushing people to death. So the Senate took our study and created a commission to investigate the president and the government. And I will talk a little about it. And our first output was this three-axis policy we saw. Firstly, the president signed decrees that defined as essential services. You might have had the same discussion in the beginning of the is it on? I don't believe so. No, now it is on. Shall I leave it on? Yes. Yeah. Okay. So I think you had this in Canada to decide what was essential services that could remain open and what should be closed during the first months of the pandemic. And we were having these discussions in Brazil, a big pressure on municipalities and states, governors to do something. And the president came very quick and published this decree to say that everything was essential services, religious service, and he has a big support from evangelical religions in Brazil. So he was trying to make a good service for them to keep churches open. The construction industry, beauty salons, barber shops, gyms, all we know that cannot be open during the pandemic because they are all activities very good for the virus. The virus would enjoy a lot this kind of stuff. Once it was a bad policy and hospitals were already crowded, the governors from all Brazilian states didn't follow the federal legislation and started creating their own legislation. And this was the beginning of the chaos because we have a Brazilian unified health system. So usually what happens is the federal government gives the policy, states and cities just follow. But here, the federal government policy was wrong and they didn't want to follow. So they started to do in different ways. So the federal government went to the Supreme Court to question the governor's legislation and lost. The Supreme Court decided for the governors, and the argument was very interesting because the federal system in Brazil, in thesis, organizes the system and the legislative structure. But in this case, what the Supreme Court told is, as states and cities are protecting better public health than the federal government, and as the Constitution says that the Brazilian state must protect rights to health, we will validate the cities and governors' legislation against the federal legislation. This was the only case it happened in Brazil. And the argument was cities and states were protecting better health than the federal government. After this first act, the president also vetoed a series of legislative measures approved by the National Congress to limit the spread of COVID-19. This was interesting too, because when the Congress saw that the president was trying to do the wrong policy, they started to approve the good rules policy guidelines, like use masks, avoid agglomerations, and these non-pharmacological measures. Now we know that are good to protect people. And the National Congress approved the laws, and the president, he had to sanction the law before it was published, but he vetoed legislative measures such as the mandated use of face masks in prisons, the requirement that businesses which stay open during the pandemic supply employees with free personal protective equipment, the mandated use of masks in closed space. This was rejected on the grounds that it would encroach on the right to privacy in one's home. Nonsense, pure nonsense. And protections for indigenous communities, including the provisions of protecting their territories from the entry of people who are not from these indigenous areas. Access to drinking water, even drinking water he vetoed to indigenous people. Food, hospitals, and ICU beds. So fortunately, the Supreme Court and the National Congress put down all these vetoes, but with big political trouble. It was all very hard, and we had to fight against the federal government and all the structure they were using to move forward the policy of herd immunity by contagion. Bolsonaro accused at that time the Supreme Court during all the pandemic, saying that the court didn't want to let people work and didn't allow the federal government to tackle the pandemic appropriately. This was a strategy he had to go against the Supreme Court. He did it during all his mandate, and that's why his supporters destroyed the Supreme Court in the January 8th. I don't know if you've seen that, because it's been 3 years. He every day goes to the television and say something against the Supreme Court. And it began here with the pandemic response. The president also excluded various occupations from an emergency financial aid program, effectively forcing people to keep working during the pandemic. So at the beginning of the pandemic, we had a financial aid for various professions, people who needed to stay home. So the government would give them an amount of money for them to stay home. Also gave money to industry and commercial establishments to stay close, but he kept some of these activities out of the financial aid program, forcing people going to streets. He also blocked Congress proposed financial reparations to families who lost members on the front lines of pandemic health care. And with that, lots of doctors and nurses simply didn't want anymore to go to the front line during the pandemic. So we had a very important shortage of doctors, especially for ICUs, in the worst part of the health crisis in Brazil. And these are just some of the measures that Bolsonaro has vetoed. We collected a lot of them, one more incredible than other. And for the indigenous vetoes measures proposed, the Supreme Court decided to obligate the federal government to formulate and execute a plan to protect indigenous people from the pandemic, provide access for food and drinking water to indigenous population, and prioritize indigenous people in the vaccination schedule. And this was very important. There are three indigenous associations in Brazil, and they are trying to sue Bolsonaro as a genocide in the international court. They think they were like being victims of a genocide because of the way that Bolsonaro was managing the policy to protect indigenous people. And somehow I think they have a very strong arguments for that. So the process is in the international court. Let's see what happens. And in this sense, the Supreme Court was essential in Brazil to guarantee indigenous people protection during the pandemic. If the Supreme Court wasn't there, we would have a real genocide of indigenous people. The second group of actions we analyzed were regarding the obstruction of states and municipalities' efforts. So state and municipal government responses to the pandemic have been systematically obstructed by the federal government. The president himself defined this as his war against governors and Brazilian states leaders who adopted disease containment measures. A few examples of these are the unjustifiable delay of emergency funds to states and municipalities, the use of only a small portion of the pandemic response funds allocated by Congress, and through the Ministry of Health, the systematic mismanagement of purchases and distribution of fundamental items like diagnostic tests, personal protective equipment, respirators, oxygen, vaccines, and syringes. And there was one time, as he was not buying it, governors and the mayors of the cities started to buy. What he did when the crisis went very hard, especially in January 2021, he tried to confiscate the materials and tests from the states and cities to distribute to, I don't know what he did want. Once again, the Supreme Court told that he wasn't allowed to do that. So the Supreme Court was really very important to protect Brazilian democracy and Brazilian people from this wrong policy the federal government was trying to manage. The third aspect I would like to comment is what we called the federal government's propaganda against public health. So despite tremendous pressure from businessmen and politicians, state and local governments have managed to avoid the collapse of Brazil's national public health care systems, with shocking exceptions like the city of Manaus, the capital of the state of Amazon, in the very center of the forest, where they were trying to adopt the non-pharmacological measures. They were pressured by the federal government to open everything, and this was a massacre. In January, February 2021, what we've seen in Manaus, we do not want to see again. Thousands and thousands of deaths in like 3 weeks, people dying without oxygen because they didn't have respirators. They were trying to sell people there. What the federal government was doing in Manaus at this time, people needed respirators. And they were trying to give them hydroxychloroquine and ivermectin and this kind of medicines that we know now don't serve for anything regarding COVID. So people died because of this federal government's propaganda and pressure regarding open the economy, this is nothing, and so on. There has been a barrage of official governmental propaganda against public health. This has taken the form of political discourse every day. They employs economic, ideological, and moral arguments and disseminates disinformation and scientifically unverified information with the purposes of discrediting health authorities, weakening public adherence to science-based recommendations, and encouraging political activism against the public health measures needed to contain COVID-19. So the president held crowded public gatherings and traveled extensively around the country to preside over ceremonies like ribbon cuttings. He has also systematically pushed the public toward contagion, saying things like, "You will all catch it someday. What are you afraid of? Face up to it. There is no use trying to escape it, escape reality. We have to keep being a country of sissies." So every day he came with this kind of speech and propaganda, trying to say, pandemic is nothing, what are you scary about? It's only a flu, go on, work, don't stay home. So these are some images for you to look. Different gatherings. Every week he was in a different city, and you see, never using a mask, never. And his supporters also hardly used masks, and he was promoting these agglomerations and saying to people, take off your masks. So he was an agent of dissemination of COVID-19 in Brazil. It was incredible to see that happening without the public authorities doing much. And this was because the general prosecutor was linked to him, and the only person in Brazil who has the authority to prosecute the president. So they are friends, so he could do anything he wanted, and no one could do anything. But political movements and science-based information, what we try to do. The next one is very impressive. It's one gathering he did. He even took the mask of a child in the middle of a big crowd gathering. A mother gave her child to the president. You know, people like the president to have their child. I don't know why, but they gave it to him. He took the child, saw the mask, and the video is very impressive. He see the mask and he take out angry that the child is using a mask, and kept like this for photos and so on. Furthermore, he has pitted public health against the economy, as if the population had to choose between one or another. And we know that it was not like that. He incited supporters to invade hospitals to show that reports about overcrowded hospitals and the shortage of respirators were allegedly fake news. They were not fake news, they were truth. But he was saying that. It was a war of narratives. And the worst thing is that his supporters did that. They entered in the hospitals with ill people there and threatened doctors, nurses, and so on to get in and see that no one was there. And there was a lot of people. So he has tried to discredit vaccines, claiming that they cause death and disabilities, and saying that if you turn into a crocodile, it's your problem. He has also attempted to convince the public that the disease was vanishing. In December 2020, he said, "We are now at the tail end of the pandemic." In the next month, January 2021, we've had more than 4,000 deaths per day in the country. His recommendation since the early stages of the pandemic that people use ineffective medicines such as hydroxychloroquine is an important element of this propaganda campaign, because telling that there was a cure for the COVID, people would be more confident to go to the street and work. This recommendation was issued by the health ministry, but not before one minister was fired and another stepped down. So he changed 2 ministries of health until he found a general who would do whatever he wanted to do as Ministry of Health. This general, he's being prosecuted now, finally. But when he got into the Ministry of Health, the first thing he said was, "I didn't know that Brazil has a unified health system." Because the military, they have another kind of health support. So he didn't even know about the unified health system, and he became Ministry of Health in the middle of the pandemic. So imagine, and because he would do anything Bolsonaro wanted. This long-standing, well-funded health ministry had an exceptional technical staff that had weathered transitions of power for decades, but was until yesterday headed by a general, while more than 20 key posts were held by military officers, most lacking any public health training or background. Then we had the Senate Investigation Commission. I'm going to talk a little bit about this and then finalize my presentation, because I think this is very important. The findings of the Senate Commission were very impressive. After almost 6 months of investigation, a Brazilian Senate inquiry into COVID-19 has ended its proceedings by recommending the indictment of federal authorities and Bolsonaro for numerous crimes committed during the pandemic. First on the list is Brazil's former president, Jair Bolsonaro, who is accused of committing crimes such as prevarication, the failure to carry out or delay of public duties for reasons of personal interest, ideological, political interests, charlatanism, the promotion of false cures, the spread of the virus. These are common crimes defined in our penal code, criminal code. But as I told you, the only person who can prosecute him is the general prosecutor, and until now, he has done nothing. He has also been accused of crimes of responsibility laid out in Brazil's constitution, which could be punishable with impeachment. But the Congress didn't want to move forward with this also, because it's the same structure. Only the president of the Federal Chamber of Deputies can move forward with an impeachment in Brazil. And this guy was also a friend of Bolsonaro. So the two persons in Brazil who could go forward with the prosecutions, they were not, they didn't want to, because they were like Bolsonaro's supporters. The report makes for explosive reading. However, it is in its accusation that Bolsonaro committed crimes against humanity that the inquiry makes a valuable contribution to global health and the future of global pandemic responses. The Commission's report outlines a systematic strategy beginning with the president that led people to engage in behavior hazardous to their life and health. Based on Article 7 of the Rome Statute, Bolsonaro and other ministers have been indicted with the crimes of extermination, persecution, and other inhuman acts. In the first version, the report had also identified the crime of genocide against indigenous communities, but this has been removed from the final report due to dissent among senators. And that's why the indigenous associations made a parallel accusation against him in the international court. The federal government has done everything in its power to let COVID-19 follow its natural course by encouraging people to become infected, recommending the use of ineffective treatments as part of official policies, and disseminating misinformation on preventive measures such as social distancing, masks, and vaccines. Until now, we don't know if Bolsonaro is vaccinated. He has never been vaccinated. He told everybody he is not vaccinated, but when he was asked to show his vaccination card, he didn't want to. So we don't know if he is vaccinated or not, but he tells he's not. But I don't believe so. I think he is, and he is making politics with this. The president also declared war against local governments that adopted measures to contain the virus and traveled throughout the country to organize and support the gathering of thousands of people in rallies. The idea of herd immunity by contagion has been used to justify Bolsonaro's actions, but this approach has been largely debunked since it is unsustainable to tackle a pandemic by letting the disease spread on a large scale. As we've seen, it was a massacre in Brazil. More than this, it is an abomination from an ethical and legal standpoint, for it entails thousands of avoidable deaths, as well as the overstrain and even collapse of healthcare systems. Brazil's federal government never changed its course of action, even in the face of catastrophic results. More than 36 million confirmed COVID-19 cases and more than 695,000 deaths. The government's failure to implement preventive measures has brought a heavy toll on the healthcare system, which is still to be accounted for, while also wasting scarce resources. The health system collapsed in some places, with hospitals at capacity or running out of supplies, leaving patients without care and healthcare staff with moral injuries. Despite all this, and even after the publication of the Commission's report, the President continued spreading misinformation about COVID. Only a day after the report was read in the Senate, Bolsonaro claimed that people in the UK who had received 2 doses of vaccines had contracted AIDS. He talked to that in the television, so he can't deny it. And now he's going to be prosecuted because he lost his privileged forum in the Supreme Court, and it's beginning, the lawsuits against him are beginning to happen. The senators at the head of the commission took the investigation to the prosecutor of the International Criminal Court. For the sake of ideology, hundreds of thousands of avoidable deaths. We have an epidemiologist with us in the team, and we calculate that almost 400,000 people could have survived if we had not had Bolsonaro in the presidency during the pandemic. That's why we defended it was a genocide, and we kind of can prove it. But let's see how it goes in the International Criminal Court now. We are now attending for the General Prosecutor of the ICC to decide about this process related to crimes against humanity. So to end up, this case should be a lesson to other countries and for future pandemics. It is critical that we prevent other governments elsewhere in the world from letting pandemics follow their natural devastating course under the excuse of protecting the economy and glorifying societal freedoms without protecting the most vulnerable people. So individual freedoms against public health issues. For the future security of global health, the international community has a duty to acknowledge that this is a crime which, although inflicted on the people of Brazil, has targeted and threatened the whole of humanity. Well, this was what I planned to talk to you. Thank you, Colleen, again for this invitation and opportunity to share, and let's debate.
Thank you very much, Fernando. So we have some time for questions and comments. If there are folks online, if you, there's not too many, so if you want to put your hand up, but otherwise, if you want to write your question in the chat, I can read it to Fernando. Does anybody in the room have a question? Yes.
Yeah, I have 2 questions or remarks. First, it's about the inflation of language, because in Sweden, the first strategy or the first step, let's say, or the first phase of the so-called solutions was rather close to that of Bolsonaro, and there's no crime against humanity or acquisition or something like that. And the other point is about the numbers. Maybe Bolsonaro is okay, but if you compare Brazil with other countries, perhaps there's not such a difference, in the end result. Maybe the other countries are comparable to Brazil. So it's not only Bolsonaro. It's not that clear. That's my second point. Maybe.
Yeah, good points. We are debating this a lot. The Sweden case was used by Bolsonaro in the beginning as a brand, like Sweden is doing that, but you must remember that they changed very quickly their policy, and they started to do the right things like 3-4 months after the pandemics began. So we can say it's the same thing, because they started with this liberal approach to the pandemic, and then they saw that the public health approach should be more respected regarding COVID-19. And
we cannot say that they were committing a crime in the first phase.
No, because when they first did it, we didn't know anything about the pandemic. And when they changed, when we started to know science-based information, how can we avoid the dissemination? Well, avoid public gathering, agglomerations, close some economic activities, and so on, so forth. So they started to do that. Use masks, and we didn't see the president of Sweden or the prime minister of Sweden go to the streets and say to people, do not use mask, go to street, go to work, COVID is nothing, you bunch of sissies. It's quite different. This make a big difference. And regarding Brazil is not so bad. I showed you it's the third one in the death rates. And even if we compare per 1,000, what would be a better comparative data to use? We are in 1.9. If we see Mexico and Peru, they are much higher. So we could think in an argument like you are bringing. But the question we are making is not comparing to other countries. What we are talking is we could have done much better, much better. And these epidemiologists in Brazil, only for vaccines, because he retarded the vaccines purchasing in Brazil. So Pfizer offered the vaccine to the Brazilian government during 6 months. The Brazilian government didn't even respond to them. This came in the Senate Commission. From July 2020 to December 2020, Pfizer sending mails and letters and so on to the Ministry of Health and to the President saying, we are going to have a vaccine around December. If you want, we can sell it to you. This is the price, blah, blah, blah. And the Brazilian government didn't even respond to that. So the starting of vaccination in Brazil delayed around 3 months. Mm-hmm. Only these 3 months, and these were the worst months. The months we had 4,000 deaths per day. And we could have had the vaccine already at that time, in December. But we only had vaccines in March. So only these 3-4 months, we could have saved around 150, 200,000 people. Some will say that if we take the vaccines, plus the masks, the agglomeration, the way he talked to people, go to street and blah, 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 Some will calculate in 400,000. So you have a point. It's true that Sweden made the same at the beginning, that if we compare, we are not so bad. But as I showed you, who are the first ones before Brazil? The countries who somehow were in the same path, wrong path. So not good comparative countries to, I prefer to compare to Canada. And you had a better quality of response here.
Thank you, Fernando. We have a question from Matt Herder online. Matt, do you want to so we can, do you want to ask a question, Matt?
Sure. Can you hear me, Fernando?
Should be okay.
Is he listening?
Are you there, Matt?
I am.
For some reason, we can't hear him. All right,
Can I make my question, because I have to teach?
please, yes,
And then maybe,
please.
no, of course, I study the judiciary, as you know, but yes, one of the things is that the constitutional system kind of reacted in Brazil, right? I mean, and I kept like thinking how lucky were you of having these channels that, you know, then you can tell me exactly what kind of things allow the Supreme Court, for instance, to block a veto. You know, very kind of sophisticated reactions on the part of the judiciary that responded well, but also because your design like allows this kind of thing, but because only, I think, with these guys, only the Supreme Court could be a real, imagine a judge of first instance. You know what I mean? And this is one, I was keeping like, thinking about the differences and the similarities, Mexico and Brazil, you know, having the same kind of guy basically and the same kind of response and whatever. And one of the differences is this, that, you know, people don't have that like fluid access to justice and this kind of challenges, but haven't gone directly or so fast to the Supreme Court. So, you know, why they reached the Supreme Court so fast? What kind of channels do you have that allow, you know, the biggest tribunal, the most like influential tribunal to be blocking the other branch of power?
Yeah, that's true. We have a good architecture for that. But we found out that we have some problems. This only the general prosecutor can go ahead with this. We will have to handle this. But regarding to put down the vetoes or some legal acts that he published, we have a direct action. We can go straight to the Supreme Court regarding federal government acts.
But they are not norms. If they are acts, you can go as well.
Yeah. But few people can go straight to the Supreme Court. And one of them is the parties. So the opposition parties were the ones who went to the Supreme Court all the time. Most of the time they would come to us and ask for legal arguments and to help them to build the petition, but they are the ones entitled to go straight to the Supreme Court and demand. So parties, national syndicates, but these remained quiet, and the general prosecutor who did nothing. So mostly the parties and the opposition parties.
Wonderful. I think we've got Matt to ask a question. Hopefully we can hear him.
Can you hear me?
Nope.
You can put the volume on your computer as we did yesterday in the meeting.
Okay. I think, all right, let's try this.
Can you try?
We were listening to him.
Sorry, just a quick technical glitch here.
Try that.
How about now?
Yeah.
Oh, great.
There's so many.
Thanks, Fernando, for that terrifying talk. I'm really interested in the interaction between the political context, the president, of course, centrally, and public institutions, and learned a lot about the interaction and the ways in which they push back and the challenges around the health ministry broadly. But I'm really curious, given your knowledge around pharmaceuticals, if you could speak or have any other reflections about other public institutions. I'm thinking of Anvisa, the health product regulator, as well as, and maybe it's not best characterized as a purely public institution, but the mRNA hub, the PAHO at Fiocruz, and I think relationship with Argentina. Any thoughts on whether Bolsonaro was actively engaged in undermining them, or how they perhaps pushed back or failed to do so?
Yeah, thanks, Matthew, for the question. This was really interesting. First, Anvisa, the National Health Surveillance Agency in Brazil. We found out during the Senate Commission that Bolsonaro tried to change the bill of the medicine to put in ivermectin, hydroxychloroquine, COVID there. So he wanted to change by decree the bill of a medicine. And the president of Anvisa, who is a military, but he has a mandate because our National Health Surveillance Agency is technically protected. So once they are there, they have mandates. So Bolsonaro put this guy there thinking that he would be in his side. But when he started to wanting this kind of policies and things, he pulled back and left Bolsonaro alone. And Anvisa did a very great job during the pandemic regarding the emergency vaccines approvals, to avoiding the incorrect use of this ivermectin, hydroxychloroquine, and so on by Brazilian people. So Anvisa was quite good. Fiocruz also is a research institution. It is related to the Ministry of Health, but it has its autonomy. So it was really nice to see how Fiocruz was able to balance between doing the right public health things. I have to look there. Yeah, doing the right public health things and also managing to deal with Bolsonaro to keep receiving money and funds and so on. And they did such a good job that the president of Fiocruz became now the Ministry of Health. And what she did, she managed to make a deal with Oxford, and AstraZeneca is Oxford with who produced AstraZeneca is
Oxford. Yeah, you're right. And the Serum Institute of India as well produced one version of it.
Yeah, so they made a deal with Oxford and started to produce AstraZeneca in Brazil in Fiocruz after some months. So it was a very good movement, and they made this quietly without Bolsonaro and the Ministry of Health knowing. It was really interesting. And when it came out to the public, it was all settled. The vaccine was there, and all the government should do was pay for the new vaccines, and he couldn't avoid that. So these were very important protections for public health in Brazil. And I credit this for their institutional design. They are designed to give autonomy to the technicians that are in charge in these institutions.
Fernando, we've got about 5 more minutes left. And so online, we have another question from Halifax from Professor Sheila Wildman. So thanks, Matt. And we'll go to Sheila while we've got hopefully a channel open to Halifax.
Sure. Can you hear me?
Perfect, Sheila. Thank you.
Great. Well, thank you so much for that talk. As Matt said, it truly is terrifying, but also so instructive to hear from you about this. So my question really follows up on Matt's, and really from what you just said about the protective effect of at least some independent administrative agencies in the midst of all the tumult that you have described. And so my question sort of levels up a little bit and asks you to, I'd like you to reflect a little on the prospect of responses or, institutional design. And I guess I'm moving you a little bit away from the prospect of deterrence, which is maybe a bit of a debatable prospect, but using criminal law sanctions, whether international or domestic. And I wonder what preventive mechanisms, whether legal or socio-political, might we identify that could serve as, that popular phrase, guardrails, to help avert this kind of war on science and on public health in the future, whether in Brazil or elsewhere. So I just put that one to you. And I think the independent admin agencies is a nice start, but I'm just led to really reflect on the depth of this, the resistance to science and public health. And in some ways, it's very hard to, get to the root of that. And then how does one try to foster, whether through institutional design or otherwise, protective, preventive mechanisms? Thanks.
Yeah, thanks for your question. It's a really good question. And the Senate Commission ran deep in this, and they made a lot of legislative suggestions to prevent Brazil from having another nightmare like we had. So we have some bills regarding misinformation, fake news, and criminalizing some conducts related to that. We also are managing a big reform on our national health surveillance system in order to harmonize in future pandemics. I hope there won't be future pandemics, but if it is, to harmonize the response of Brazilian authorities and put some health democracy in the middle of it. Mm-hmm. So one thing that we figured out is that there was no participatory institutions during the pandemic where patients, people, and society in general could go and give their arguments and their opinion and so on, and bring science-based information. They in the federal government, they shut it down. All the participatory paths were closed. And in some states, like in the states I live, state of São Paulo, we had a commission, but it was a commission from the state of São Paulo authorities. No society, no academy, no patients. So I think and one thing we are putting in the project to change our national surveillance system is to improve the health democracy in the health surveillance system and decisions. Let's see what comes out. We have a new parliament, new Senate now, and I don't know how things are going to move, but we know we have to change a lot of things to avoid another experience like this one.